Hello student, I am Anjali Wankhade, Assistant Professor, Department of Pharmacology, Vidya Bharati College of Pharmacy, Amravati. In this video tutorial, we will discuss about anti-anxiety drugs. After completion of this video tutorial, you will be able to define anxiety and classify its different types, explain symptoms and pathogenesis of anxiety, define anti-anxiety drugs and classify them, discuss pharmacology of benzodiazepines. Definition of anxiety. Anxiety is a physical and emotional distress which interfere with normal life. Symptoms of anxiety includes psychic or emotional state, somatic or physical symptoms. Common emotional symptoms of anxiety are irrational and excessive fear and worry, irritability, restlessness, trouble concentrating, feeling tense. Common physical symptoms of anxiety include sweating, tachycardia, that is increased heart rate, stomach upset, shortness of breath, frequent urination or diarrhea, sleep disturbances, that is insomnia, and fatigue. Types of anxiety are first, generalized anxiety disorder, second, post-traumatic stress disorder, third, obsessive compulsive disorder, fourth, panic disorder, and fifth, phobia. Generalized anxiety disorder in patients are usually and constantly worried about health, money, work with no apparent reasons. Obsessive compulsive disorder is an anxiety disorder in which people cannot prevent themselves from unwanted thoughts or behaviors that seems impossible to stop, as for example washing their hands. Panic disorder is a disorder in which people have sudden and intense attacks of anxiety in certain situations. Post-traumatic stress disorder is an anxiety disorder that affects people who have experienced a severe emotional trauma such as rape or dramatic car accident or even a war. Phobia is an intense, uncontrolled fear of specific situation such as open spaces and heights. Now, we'll discuss about pathogenesis of anxiety. Pathophysiology of anxiety is still unclear. It includes imbalance in neurotransmitter system. It includes excess of neurotransmitter substances such as epinephrine. It also includes deficiency of inhibitory neurotransmitter such as GABA amino butyric acid, that is GABA in the CNS. Now, the reflection spot. From the pathogenesis of anxiety, what should be the goal of drug treatment of anti-anxiety drugs? Just think and write. The goal of drug treatment of anti-anxiety drugs should be: drug should calm the patient without producing drowsiness, drug should relieve the symptoms of anxiety, drug should decrease the excitation of excessive neurotransmitter, and drug should enhance the GABA neurotransmission. Now we'll move towards treatment of anxiety. Treatment of anxiety include psychotherapy, that is cognitive behavioral therapy, and second, anxiolytics. Anxiolytics are the drugs that are used in the treatment of anxiety. Classification of anxiolytic drugs. First, benzodiazepine. Second, 5-HT1A agonist. Third, 5-HT reuptake inhibitors. Fourth, antidepressant. Fifth, beta-adrenergic blocker. And last, monoamine oxidase inhibitors. Benzodiazepines. Classification of benzodiazepine are: first, short acting. The action lasts for 3 to 5 hours. Example is triazolam. Second is intermediate acting. Action lasts for 6 to 24 hours. Example are alprazolam, lorazepam, oxazepam, istazolam, temazepam. Long-acting action lasts for about 24 to 72 hours. Drugs are clonazepam, chlordiazepoxide, diazepam, flurazepam. Mechanism of action of benzodiazepine. Benzodiazepine act by binding to benzodiazepine receptors in the brain. Benzodiazepine receptor site is located on the GABA A receptor. Binding of benzodiazepine on benzodiazepine site on GABA A receptor facilitates GABA to bind to GABA A receptor site, thus causes chloride conductance, that is, opening of chloride channel. Chloride entry inside the cell membrane causes hyperpolarization and inhibition of the neuronal system and thus CNS depression. Pharmacokinetic of benzodiazepine. Benzodiazepine are lipid soluble, well absorbed orally, can be given parenterally. Chlordiazepoxide, diazepam are given IV only. Widely distributed, cross placental barrier, thus causes fetal depression. Excreted in milk, thus neonatal depression. It is metabolized in the liver to active metabolite, long duration of action and thus cumulative effect. Redistribution from CNS to skeletal muscle, adipose tissue results into termination of action. Pharmacological action of benzodiazepine. First is anxiolytic action. Second, depression of cognitive and psychomotor function. Sedative and hypnotic action. Anterograde amnesia. Minimal depressant effects on cardiovascular system, respiratory system. Some drugs have anticonvulsant effect also, such as clonazepam, diazepam. Therapeutic uses of benzodiazepines are anxiety disorder, causes short-term relief of severe anxiety, general anxiety disorder, obsessive compulsive disorder, panic attack with depression. Drugs are alprazolam, sleep disorder, insomnia. Drug used in insomnia are triazolam, lorazepam, florazepam. It is also used in the treatment of epilepsy. Drugs are diazepam, lorazepam. In anesthesia, it is used in pre-anesthetic medication, example diazepam, and induction of anesthesia, example midazolam. Adverse effects are ataxia, that is motor incoordination, cognitive impairment, hangover such as drowsiness, confusion, tolerance and dependence. There is also a risk of withdrawal symptoms, rebound insomnia, anorexia, anxiety, agitation, tremors and convulsion. Toxic effects of benzodiazepine includes respiratory and cardiovascular depression in large doses. Drug interaction causes CNS depressant with alcohol and antihistaminic drug by increasing the effect of benzodiazepine. With cimetidine and erythromycin, there is an increase in half-life of benzodiazepine due to cytochrome P450 inhibitors. With phenytoin and rifampicin, there is a decrease in half-life of benzodiazepine because phenytoin and rifampicin are cytochrome P450 inducers. The dose should be reduced in liver disease and old people. It should not be used in pregnant women or breastfeeding or the people over the age of 65 years. Thank you.